Hi friends. Welcome to Dentistry Love channel.
Perforation. Introduction. Perforation is an artificial communication between the root canal system and supporting tissues of the teeth. Root perforation complicates the treatment and deprives the prognosis if not properly managed. A wide variety of materials to seal the perforations have been suggested. This perforation acts as an open channel encouraging bacterial entry either from root canal or periodontal tissues or both, eliciting inflammatory response that results in fistulae, including bone resorptive processes may follow. When perforation occurs laterally or in furcation area, there might be overgrowth of gingival epithelium towards the perforation site, worsening prognosis of the tooth. Types of perforation includes coronal, furcation, lateral wall or strip perforation, root canal perforation, which in turn includes cervical, midroot and apical, then post-space perforation. Types of root canal perforation, which in turn includes cervical, midroot and apical. Strip or lateral wall perforation. Definition: strip perforation is defined as a perforation due to inappropriate shaping technique causing severe deviation from the normal root canal anatomy and leading to pathologic communication with the surrounding periodontal tissues. Predisposing factors include inadequate knowledge of tooth anatomy, curvature. Improper use of drilling instruments leads to gouging. Forceful or unregulated canal instrumentation leading to ledge formation, zipping with or without elbow formation and loss of apical constriction. Irregular tooth morphology, X-inclined crown, curved root canals and calcified pulp chamber. Management: crestal perforation at the level of the epithelial attachment into the crestal bone has questionable prognosis. Apical perforation is apical to the crestal bone and the epithelial attachment has good prognosis. In multi-rooted teeth where the furcation is perforated, the prognosis differs according to the factors described for single-rooted teeth. Perforation repair, step by step. Here a radiographic exam revealed poor RCT and suspicion of FURCAL perforation with FURCAL radiolucency. Crown was removed. Access was done through old amalgam filling and base material. Severe bleeding was observed. After bleeding control, we can see the perforation site. All restorative material was carefully removed with ultrasonic tips under high magnification, then a clear view of the perforation could be obtained. Retreatment was initiated with gutta percha removal and orifices relocation. Irrigation can be done to clean the perforation site. With high magnification we can notice the formation of the granulation tissues invading the perforation site coronally. This tissue should be removed before MTO repair by manual excavation. And calcium hydroxide dressing for 2 to 3 days. Clinical image showing the difference after excavation and 3 days of calcium hydroxide dressing. Clean perforation with no granulation tissue. Now the perforation is ready to be sealed and repaired by MTA or any other biocompatible material. Before MTA placement, sponge matrix is used outside the perforation in order to prevent MTA extrusion to the FURCAL space. MTA was packed gently in the perforation site and adapted with pluggers, paper points and micro brushes. MTA adaptation with micro brush. Complete root canal treatment and obturation with CWC technique after MTA setting. Post-op radiograph showing the RCT, MTA perforation repair and the final restoration with fiber post and resin core. 1 year recall showing good healing in the FURCAL and apical areas. Prevention: study the preoperative radiographs and meticulously evaluate the pulp chamber morphology. Access burr penetration for depth and angulation should be confirmed before proceeding with designing access cavity. Straight line access is an important consideration in all access preparations. While preparing access cavities, if a ceramic crown or a metal crown is already present, it is better to remove the crown and proceed with endodontic access and treatment. When there is an existing restoration, it is safer to remove the old restoration to rule out any secondary caries at the floor or axial wall, following the principles of canal preparation, which include Precurving. Straight line access. Retaining its original form and shape. Irrigation. Restricting instruments within canal. Recapitulation and removal of dentinal debris.
Thank you, friends. Please do subscribe for more videos.